We work with people with quite severe and enduring mental health.
It's not a linear process. Sometimes things go really well, and sometimes they don't go quite as well. And it's our job to be there along the way. My name's James. I'm a recovery coach, and essentially I help people move forward in their lives.
My name is Rachel Leghorn. I'm the service manager with SAMH.
We support people with a range of challenges. A lot of them have formal diagnoses. They might be neurodivergent. There's a lot of people that have experienced psychotic episodes and can be very threat conscious. They're very worried about what other people might do to them. So a big part of my job is building relationships. So I've spent the last year trying to build relationships with some of these people so that they can begin to be vulnerable around me. Because it's hard to be vulnerable around people when other people might not have given you good reasons to trust them. We work with people who have been in care environments for a long time. So that could be things like hospital. They could have been in child's homes when they were younger. And they've not really had the opportunity to build secure attachments with people that a lot of us have been lucky enough to have. So they come here to help them move from those environments to something more independent. So we're a bit of a bridging gap between, having these carers around you all the time to having your own flat where you're able to pay your own bills, go out and have hobbies, and maybe even get a job.
Some people just need somewhere to be safe, and everybody's entitled to that. That could be receiving medication in a safe manner. It could be being financially able to live independently. We do have appointeeships, so we work with them to hopefully get them to a stage that they can have that independence. We want to try and stop bed blocking within hospitals. We had a person that we supported who ended up being in hospital for 27 years. It was a lot longer than the initial was ever supposed to be, and 3 years of that was actually held up through the COVID-19 pandemic. It's really crucial that we have these supported accommodations.
Day to day, we'll sit down in the morning, the staff together, and we'll figure out, what's been planned for the day. And then we'll go around, do the scheduled activities with the service users. There could be something as simple as going to the shop, it could be going to the gym, it could be helping them access benefits or the support from the government. And we'll also sit with them and just kind of figure out, look, is there something we could do today that you've been putting off? Because we work with people who have struggled to take the steps that they need to achieve the things that they want to. So it does involve a lot of motivational work. Sometimes it can start with, let's walk to the shop and have a conversation, and that can turn into, all right, let's go and set up that GP appointment that you need. Let's go to the dentist and get that appointment done that you need. And these small interactions act as a way to help them move forward to figure things out, rather than sitting down in more formal one-to-one situations where someone might feel quite intimidated, and it can just be really difficult in those situations.
And this is this kind of scary thing almost, is people become institutionalized, because within a hospital environment, we're pro-choice and everything like that, and absolutely if that's what they need at the time, but it becomes so rigid, and it's such a kind of rigid way of life because it has to be, absolutely. But they're also taking away independent factors such as making their own meals.
Well, you're talking about people who they've been in environments where they've been very, for want of a better term, controlled. They are told when to eat in the morning, they're told when to eat in the afternoon. Some of them will have done hobbies, but they'll have been put on by other people, whereas they come and work with us, and it's now in their control, which is a challenge, because you're saying to someone who's now an adult, who hasn't had the opportunity before, to be go out and just do this, and that's what we're there for, to help them figure it out. And when you get that achievement, it's we did something, we moved forward. And it's like a small thing, getting someone to have a hobby, but there's skills around that which are so important for everyday life.
Getting getting them to a place that they are mentally able to do these things and their well-being is good enough to be proactive and engage with us. And there's been a lot of success stories there. We worked with a person for 7 years. They were with us. They were on a appointeeship. We worked with them to come off appointeeship, which was massive in itself, but also they never used public transport for over 5 years due to a previous trauma. So all of these things we had to overcome, and it ended up that when they moved out, they got their own tenancy, which was absolutely remarkable, really. And they actually phoned me to let them know that they had went and chose their own sofa. And I think for us, we take that for granted that, great, that's absolutely brilliant. But they had to draw on all of that confidence, resilience, life skills that they had worked for 7 years to achieve, to go and be able to do that, to budget, to save up for the sofa, to get on the bus, to go, to use that confidence to be able to pick on rather than rely on kind of other people to say, "No, that one looks good and it's within your budget, that's the one you're getting." They made their own decisions there, and for them now at the age of over 60, for the first time in their life, were able to do that for themselves.
I think most people want to believe that they have agency. If they do something in the world, they will see results. But a lot of people, because of the situations they've been in, like being in care as a child, being in hospital, coming out, having these aspirations to want a job, to want a hobby, to want, these friendship groups where they feel supported, and then they look around and that's not what they've got, and they have tried, they have really tried. So I would hope that through our service, they can regain that sense of agency and they can think, well, no, actually, no, there are things I can do in the world to improve my life, and it's not going to be perfect. It's never going to work 100%. It doesn't work like that for anyone. But they can regain that little bit. And that's such a good skill to take out into the real world and to move forward.
It can be really, really challenging when you're getting met with kind of roadwork, brickworks, things like that. So I have an individual who we've worked with for 8 years now to thrive within, and they absolutely have done. They've done great for all the challenges that they had through that, and we're now ready to get them moved on into their own place, and we've been told it's 2 to 3 years waiting list to have that. And that's where it can be difficult, because we are doing great work, but there's only so many limits to that, and that's where we kind of need a multidisciplinary approach. And everyone, I think, is on the same boat. We all want to do the best, but their resources are tight. We're all just trying our best to navigate it, but it is challenging.
If you've been affected by any of the issues we've been covering this evening, help is available. You can get in touch with SAMH on 0344 800 0550 or via email.